grabbing the second to lightest Theraband. I'm going to have you tie it to the roller and place the roller with the band that you've tied, which should be closer to the wall than the outer edge. We're going to do some straight arm lifts that cross the line of the body on the diagonal. We're going to place the ball between the knees to engage the inner thighs and keep a soft bend between the knees. We'll take the arm, let's start with your non-dominant arm so we get more repetitions in on that side. Coming up, so for me, my non-dominant side is my right side, so I'm going to take it up, 2, 3, and down, 2, 3, focusing on strengthening the back of the shoulder, 2, 3, and down. But what's nice about this is we're getting some adductor work, upper body work, and we're working the transverse abdominis because we're unstable. We're having to balance. So I don't want you to take the hand off the wall or counter, but I don't want you clutching it. You should be using those internal core muscles for some of the balance. But the wall is always there for safety. Give me 2 more on this side, and then I'd like you to make your way to the other side. You'll have to move the band, setting up. And when you're ready, we'll begin on your dominant arm side. For me, it's the left. Taking it up on a slow 3 count. Your exhale should be on the way up, and your inhale is on the way down. Palm is facing forward. So palm faces the hip when you start there, and by the time the arm is up in the V, the palm is facing forward. Check in with your breath. Use the breath. It will help the movement. Brace the core. Make sure the knees aren't locking, squeezing in on that ball. And make sure you don't have all the weight in your toes here. I'd like some weight in the heels. You'll probably be more in the center of the foot, kind of wrapping the arch of the foot around the roller, kind of like a bird does when he wraps his feet around a branch. So you can use the arch of the foot here, or you can really challenge the balance and come more onto the heel as you're working. Make sure you're holding the counter or wall, and you feel safe enough to do that if you do choose to come to your heels. Let's go ahead and set up. We're going to do some isometric lunges with lifting and chopping. We'll need a 3-pound weight. Let's start by stepping your dominant leg back, taking the weight to the outer hip, and then up on the diagonal. So this is similar, except we're using both arms to lift and lower. And there's now a torso twist. Before we kept the body straight on, we didn't rotate the body. So I want you to engage the back, but also to engage the abdominals with this twist. We're isometrically holding the lunge to challenge the quadricep here. Give me 4 more twists, really working on the strength of that non-dominant quadricep. Breathing into that. After your 4th one, go ahead and switch sides. Since this is your dominant side, we'll do 6 here, taking it up on the exhale, lowering on the inhale. Now, if you find you don't have the balance to go that quickly, exhale to lift and lower. So pause on your inhales to prepare and lift up on the exhale, pause at the top, inhale, and lower down, exhale. Make sure the weight isn't all forward in the toes, the knee isn't tracking beyond the metatarsals, the ribs are closed, the chin's retracted, and head is back on the spine. A lot of checkpoints. Let's go ahead and set up for a series of balance work, moving forward and back in the sagittal plane. We need our lightest loop band to go around the ankles, and we'll hold on to that 3-pound weight. Do this exercise by a wall for safety purposes. You're going to step forward. Your outside leg will come up into knee flexion and you'll balance that weight. Just putting your pointer fingers there for safety. Holding inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Hold on to that weight and put the foot down. Now I'd like you to step the leg closest to the wall back and lift the outside leg again, resting the weight on it, balance. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And turning around, repeating on the other side. Make sure your foot's dorsiflexed. Do your checkpoint work, stepping to balance. Hold. Where's the weight distribution in the foot that you're standing on? Is your tailbone tipping back? Are you rounding your low back or are you arching it? Are your ribs closed? Is the head on the spine or is the chin forward? Retract the chin, give me a double chin. Keep the collarbone wide, keep the sternum reaching towards the back ribs, and repeat one more time, stepping back. So I want you to practice moving through space to balance. This will really help your proprioceptors and your neuromuscular system to fire. When you do lose your balance, you'll be able to catch yourself because your muscles are used to recovering quickly and unilateral balance work. Holding, dorsiflexed foot. And let's go ahead and come out of that, setting the loop band to the side as well as the weight and grabbing a chair. We'll need our heaviest Theraband. We'll use the chair and the wall for a hamstring stretch with the dorsiflexed foot. Let's begin with your dominant leg. Wrapping the band around it, isometric row. You can hold it with the outside hand and one hand on the wall for extra security. Or if you feel balanced today, you could hold the band with both hands and do a row here to engage the back muscles, with the emphasis being on the hamstring stretch. So I'd rather you hold on to the wall if you're rounding your low back. And it's likely you are because the hamstrings are very, very tight due to your posture. So quality versus going hardcore. Let's think about longevity and really opening those hamstrings for better range of motion. So tip your tailbone back, dorsiflex that foot hard, softly bend that supporting knee. Make sure you're not rolling out on the foot or locking the knee. And then you're hinging forward from the hips to intensify the stretch in the hamstring. And you can hear your breath. Each exhale's a chance to go a little deeper into the stretch. Great. Let's make our way to the other side, setting up. Once the chair's there, you dorsiflex the foot, bringing it onto the chair, looping the band around it, holding it with the outside arm, tipping the tailbone back, softly bending the knee, reaching the chest towards the thigh without losing the extension in the low back. Holding it here. Inhale. Exhale, deepening the stretch by coming forward just an inch. Inhale through the nose, draw the navel in. Lift up on those muscles that stop your stream of pee. And exhale to deepen the stretch. And one more time, inhale, abdomen in. Lift up on the muscles that stop your stream of pee. And exhale, lift, deepening into the stretch. Go ahead and let's stand center without the band or chair. And we're going to grab our opposite wrist, crossing one leg behind and taking a nice side body stretch here, pressing the pelvis forward. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Switch sides. And inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Great work.